If you or someone you love needs help staying safe at home, understanding New York's Managed Long-Term Care Program, or the MLTC program, is the first step. This video is for anyone trying to help an elderly or disabled person live safely at home, whether you're a family caregiver, a social worker, a hospital discharge planner, a nursing home case manager, or even a physician who wants to help your patients avoid unnecessary institutional care. By the end of this video, you'll have a clear understanding of how MLTC works in New York, who qualifies, and how you could start home care services through Medicaid. At Aaidebook, we've helped hundreds of families in the 5 boroughs of New York City and in Nassau County successfully navigate this process. And I've seen firsthand how life-changing this program can be when handled correctly. So what exactly is managed long-term care anyway? So managed long-term care is a Medicaid program that coordinates long-term care services for adults who need help with activities of daily living, such as bathing, dressing, meal preparation, or just getting around safely. Before MLTC existed, home care in New York was extremely fragmented. People had to juggle separate providers for home attendance, nursing care, physical therapy, transportation, and medical equipment, often dealing with multiple agencies that didn't communicate with one another. MLTC was really designed to fix that. It brings everything under one managed plan that handles all of your long-term needs. One plan authorizes your home care hours, provides transportation to medical appointments, coordinates your doctors, and even delivers medical supplies directly to your home. The purpose is simple. It's really to help people stay independent, help them stay safe, and cared for in their own homes for as long as possible. Now let's talk about who qualifies for MLTC in New York. First, you must be at least 65 years old or 18 or older with a chronic illness or disability that requires long-term care. Second, you must be financially eligible for Medicaid in New York State. That means that your income and assets fall under the Medicaid limits, or you are able to establish something like a pool trust to protect excess income while maintaining eligibility. Third thing is that you must require long-term care services for at least 120 days. That's roughly 4 months of needing personal assistance with daily tasks like your dressing, your eating, or just getting around. And finally, you must live in an area where an MLTC operates. Now, if you're in the 5 boroughs of New York City and Nassau County, there are plenty. And for those who are watching from upstate New York, there are several plans that cover different areas and different counties within the upper area of New York. If you meet the criteria, then you're likely eligible to receive home care services through an MLTC plan. Before I explain the different types of plans, I want to take a pause here for a moment. If you're already realizing that this might apply to you or someone that you care for, I don't think that you should kind of wait to start the process. Our company Aaidebook helps you every step of the way, from applying for Medicaid to completing your assessments to selecting the right MLTC plan and even coordinating your home care services. We serve residents throughout the 5 boroughs in New York City and also Nassau County. So if you do need help for yourself or a loved one, just use the link below. You can click through and you can pre-register, and one of our representatives will reach out to you right away to help you begin your journey towards getting home care. We know this process can be pretty confusing, but with the right guidance, it doesn't have to be overwhelming, and that's why we're here to help. Now, when it comes to the type of plans, there are 3 types of managed long-term care plans in New York, and understanding the difference is important. The first plan that I want to talk about is the partial plan. Now, this option covers long-term care services such as home attendance, therapies, transportation, and adult daycare programs. But your primary medical will still be covered under Medicare or under your straight Medicaid if you don't have Medicare yet. Most seniors in New York State start here. The second is the Medicaid Advantage Plus plan, often referred to as the MAP program. This combines your Medicare, which is a federal entitlement, and your Medicaid benefits into a single plan. You'll have one insurance card, one set of doctors, and one care manager coordinating everything. Now, MAP plans are great for people who want simplicity and few moving parts. The third option and the third type of plan is the PACE program, which stands for the Program of All-Inclusive Care for the elderly. PACE is a fully integrated model that includes your medical, social, and long-term needs. Many PACE participants attend an adult health center regularly where they receive medical care, therapy, meals, and social interactions, all coordinated by the same team that provides you coverage. The right plan for you is going to depend on your health, your preferences, and the level of independence that you want to maintain. And that's exactly the type of guidance that we provide when we're helping our clients or helping people enroll. Now, I know that you may want more detailed guidance, so let's go through what the enrollment process looks step by step. So starting with step 1, you start by applying for Medicaid. If you already have Medicaid, good for you, that's great. You could actually move right on into the assessment phase. If not, our team at Aaidebook could help you complete your Medicaid application, gather your documents, and handle the submission so that your local Department of Social Services or HRA office could get you set up with Medicaid. Step 2 starts with once you have Medicaid. Once your Medicaid eligibility is confirmed, you'll have a clinical assessment, typically conducted by the New York Independent Assessor. We call this assessment the NYIA. This evaluation determines whether you meet the medical criteria for long-term care, and they'll ask you about your ability to perform your daily tasks like bathing, eating, toileting, your mobility, when are you home alone, what medications you're taking. And what they're doing is really trying to make sure that you're somebody who needs nursing home level care but within the home. If you score too low on this NYIA assessment, they're going to deny you for home care services, and then you're going to have to wait a few months to be reassessed and see if your condition has changed and has you as eligible to receive home care services. From there, we can move on to step 3. After you're approved and you're scored appropriately through your NYIA assessment, you can choose an MLTC plan that serves your area. Each plan has its own provider network, which means who's actually going to be providing the care. So the home care agencies, the transportation agencies, and they each have their own approach to care management. So moving on to step 4, after you've selected a plan, the plan will then send another nurse to conduct a second assessment. Together, you'll develop a plan of care that details how many hours of home care services you'll receive, what services you want and need, and which home care agency will provide them. It's usually at this point that you pick Aaidebook to be your home care agency if we're in network with the MLTC that you chose. Usually that's kind of what happens with our clients. They get familiar with us, with working with our team, and they just continue. But you ultimately have the choice to work with whoever you want. It's always the patient's decision which plan they want to register with and which agencies and providers they want to be serviced by. Moving on to step 5. Once the plan authorizes your care, services can technically begin. They're going to send a authorization document to your home care agency. And with that, the home care agency will assign a home health aide or personal care aide to conduct your visits according to the schedule outlined by your plan. This is going to help you with your daily activities and ensuring safety in the home. Now at Aaidebook, we guide clients through each of these steps. I've personally worked with families who started this process feeling completely lost, and sometimes after a loved one was discharged from the hospital or rehab with no clear plan in place. We've helped them move from confusion to ultimately relief, ensuring that proper services were authorized quickly so that the person that they're caring for can return home safely with the right level of support. The earlier that you start this process, the better, because just as I described, this process could take anywhere from 30 days to 90 days. And it's going to take closer to 90 days if you don't have Medicaid yet. If you have Medicaid and everything is clear with your Medicaid, we could probably get you enrolled in 30 days to about 45 days, depending on when we start your process. As you can imagine, people often have a lot of questions about how MLTC works. One of the most common questions is, how many hours of care will I get? The answer to that is that it really depends on your level of need as documented during your assessments. Plans will base their decision on your functional limitations, medical needs, and your ability to stay safely at home. So things like the schedule of your other caregivers in the home, how complicated your care is. For example, if you are in a wheelchair or you're totally bedbound, they're going to have to increase your hours because you're going to need more support. Another question is, can I choose my own home care agency? Yes, but only if that agency is also registered with the MLTC plan that you chose, because each MLTC plan has their provider network. So if you chose a plan that your agency is not a network with, then they're going to make you pick from their provider network. So if you're working with an agency like ours, it's kind of important to know what plans they accept. That way, when you're picking your plan, you know that it's already a match between the agency and the plan itself. We often help families compare which agencies are affiliated with which plans to make sure that there's a right fit and that there isn't any drop-offs. People also ask, what if I already have Medicare? Well, if you already have Medicare, that's fine, because MLTC is designed to work alongside your Medicare. If you remember, Medicare is a federal program, and all the long-term care that you're looking for is actually covered through Medicaid. You'll continue seeing your regular doctors while the MLTC plan covers your long-term care needs at home. And what you really need to take away from this is that Medicare alone doesn't cover long-term care. Medicaid does. And finally, another frequently asked question is, what happens if I don't agree with the plan's decisions? Well, the fortunate thing is you have rights. If your hours are reduced or denied, you can have a fair hearing or file an appeal. We've successfully guided families through this process to restore needed hours or overturn unfair reductions. These are the kinds of challenges that we see every single day, and with the right help, they're entirely manageable. Now, if you or someone you love needs long-term care services, the MLTC system in New York is one of the best resources available, but only if you know how to navigate it. It's not easy, and at Aaidebook, we've helped plenty of families in the area secure the care that they need, from their initial Medicaid enrollment all the way through their home care worker placement. Our experience means that we understand the paperwork, the assessments, the agencies, and the nuances inside and out. You don't have to figure out this alone. If you click the link below, one of our representatives will contact you right away to help you start the process. We'll review your situation, assist with the applications where necessary, coordinate with the MLTC plans, and make sure services are in place as quickly as possible. Because at the end of the day, everyone deserves to live safely and in the comfort of their home, surrounded by the care and support that they need. Remember, this is an alternative to institutional care and going into something like a nursing home. So if you want to stay in the comfort of your home and get the sort of help that will make a difference in your life, just reach out to us and we'll be happy to help.